female on the lineup for today is pretty well placed to give a little bit of an oversight or an insight into perhaps some of the differences between male and female players, and particularly in the performance space. So we're not really talking too much about your club and your general participation play, but we're talking about those really players who are tuned in to getting into the high performance space for tennis. So most of you know me or have seen me at some time, and you might have heard me talk a little bit about this beforehand. So that's just me. I'm physio, S&C, and PhD in sport and exercise science, and big focus was on athletic development. So I've been training elite tennis players for about 14 years now. So there's lots of things that I've learned along the way, and how I do things differently for my female players versus a male player. So again, I'm going to focus more on the physical side rather than the tennis side, but I think there's a lot that you can take from this that you can apply to your tennis training, and at least have a sort of thought process in your mind around things you might be doing on court and off court to support your female performance players. Okay, so yeah, this one seems to not work properly, but let's go through here. What are the players' motivations for playing tennis? Why are they there? Are you meeting your female player where they are at? So are they going, I want to be a pro, I want to be top 100, and are you providing a service for them that's enabling them to take all the milestones, meet all the milestones that Scott touched on before, to try and achieve that goal? What does that look like? What does that look like in tennis? What does that look like from a physical training perspective? What barriers might female players face versus male players? What things do you think limits them from doing everything that a male player might do? Is that, just as a kind of opener, is there anything that comes to front of mind for you guys when you think about female players who are trying to be in high performance? What might be different to some of your male players? Anybody got anything for it? Numbers of females? I can just tell looking at this room, number of female coaches, number of mentors, number of female coaches to look up to, players to aspire to domestically. Just a few things, and what considerations are you guys making regarding the key differences between men's and women's tennis? I think if I pressed you all for, can you tell me some game style differences? Can you tell me some technical differences? You'd be pretty quick to get your hands up there. I think they're quite obvious, and especially at professional level, you can really see a difference between the two games. A lot of people will argue that they kind of different games entirely. So what I'm going to do is I'm going to bring the science bit, but we're just going to touch on it. I'm not going to go too nerdy on you, but you can try and rein me in if I do. Physiological differences. You know, we have smaller hearts. Females have less lung capacity. We have lower diastolic pressure, so it's the output of your heart, so how much blood is pumped out at any one time and any one beat. And so that means a lower cardiac output. So our heart is not as big and strong as males. And you have a lower VO2 max as a consequence of that. And the other thing is lower bone density. And once you get into adolescence, this can also be further affected by different things related to puberty. And this is something that male coaches need to be aware of as well, because I can look at Reynolds here, and stress fractures is number one thing that we can talk about in relation to female players and bone density. So visual differences, don't really need to go too much on this, but in the science bit, we know that females are generally smaller, generally lighter. We have a higher body fat percentage, and you know what that would correlate to in terms of performance. Well, the biggest correlation between body fat percentage is to agility, to movement. So if you have a performance player who is perhaps carrying more body fat than they would like, it is going to have a significant impact on the way that they move and how fast they can move. Broaching that subject with an adolescent female is probably a little bit tricky, especially as a male coach. But you can do this in appropriate ways and supportive ways that teach her that focusing on ways of improving her fitness and decreasing body fat percentage in a healthy way can be really, really impactful on their performance in tennis. And we know that men are generally wider at the shoulders and women are wider at the hips. This changes centre of gravity. Men's centre of gravity is generally higher around the chest, and women more around the belly button. That's why if you've ever done any self-defense, they'll teach you to shoulder man on the shoulders and woman on hips. So there's another thing to think about in terms of physiological, is that girls mature or go through puberty at a different age. So it's roughly about 2 years before a male player. So around 12, you would expect them to go through their what's called their peak height velocity, which is the fastest rate that they're going to grow during their whole adolescence. So depending on their ultimate adult height, this might vary from a couple of inches in the year to 8 inches to 10 inches. Some teenagers do this really nicely and progressively and gradually. Others go from 0 to 100 and you get that tall baby giraffe kind of syndrome going on, and that's also known as adolescent awkwardness. So those, I've turned myself off, whoops. So following the up bit, we get the out bit, so it's called the peak weight velocity, and that it can be 12 to 18 months after they've gone up. So there might be a bit of a lag, so when you're waiting for that tall skinny player to fill out, you might have a bit of time between those two things happening. But for an average girl, the peak weight velocity is around 12.5 years. So you're going to see them gain around 50% of their adult weight during that time. So as a coach, what I'd be really mindful of between the age of 11 and 13 is that that's a hell of a lot of change, a hell of a lot of growth, a hell of a lot of muscular development, bone development, lots of things are going on in their body. It is very normal to see them struggle to perform simple motor tasks. And this is boys and girls, by the way, but just to note that you might see your female players just doing straight out of green ball, coming into yellow ball, and they've hit PHB at 11, and all of a sudden they're all uncoming and think, oh god, they're not really coping with this transition very well. Is it because they've moved from green to yellow ball, or is it actually because they're in the middle of their adolescent growth and there's a lot of things going on for them? So if they're struggling with balancing, running, coordination, change of direction, you're not always going to see them being horribly on code. You might see it subtly. You might see them mistiming things. You might see them not as effective at catching as they were. So you guys as coaches being in tune with those sort of changes, go, okay, let's build some more stuff into the warm-up. Let's have a little bit more focus on balance before we start this session. If you're trying to get something technical and their kinesthetic awareness is poor, you're going to struggle to get some technical development as somebody who doesn't have awareness of their body at that point in time. So picking the things which they are struggling with and working on them as a coach, as well as the physical trainer, the strength conditioning coach, is going to be really, really useful. So yeah, so just be mindful that they've effectively got new bodies. So we heard Scott say there's no such thing as a late bloomer, but there is such thing as an early and late maturer. So that's defined by your genetics. That's in your DNA. You're either going to be an on-time maturer, so right about 12 for our females, or you're going to be early, and this is normally anything prior 11, you say it's early, and after 13 is late for a female. So you can be aware of those differences, and you can actually measure it as well. So if you measure a player's height, their sitting height, their weight, and their date of birth, you can pop it into this really nice calculation, which will tell you a guesstimate right about where they are in their adolescent growth. So this is something that we use in this S&C department to be aware of, okay, this player's coming up to their growth spurt, we need to be mindful of lows, we need to be mindful of what they're doing on and off the court. So before that outward phase happens after the growth, we know that our children, and especially females, are going to be more predisposed to injury, essentially. They don't have the muscle mass, they might not be as good as absorbing force, and they might be limited in their physical performance. So this increases their overall risk of injury. So again, not just in females, but particularly between 11 and 13 for female athletes, you're going to want to be mindful of the things that are going to predispose them to injury. These are things like overuse, overtraining, poor technique, over-competing with players much bigger than themselves, even if they're talented. So if you've got a talented 12-year-old, you're going to have to make sure that they're conditioned if you're wanting them playing in the 14s and the 16s and the 18s with players who are significantly bigger, heavier, and providing a heavier ball towards them, because they might not be in a position biologically to cope with those loads, even if they're talented. Afterwards, after you get that muscle development, then you're in a better space. So then they're really in a position to develop their strength, and this will create performance outputs that you want to see. So you're going to see increases in speed. Yes?
Sorry, I just had a question on the previous point.
Yeah.
If you have, let's say, like a talented kid that's in that PHB phase,
yeah,
what would you say are the telltale signs severe injury or something that might take them out for a few weeks. Is there anything that like you can maybe recognise before it gets to that point if they're like overdoing it or something?
Yeah, that's a good question. So I guess if they're not quite, if they've gone through the adolescent growth spurt, you would probably know that through just observations, right? You'll go, they've shot up, your arms and legs, or you have those adolescent awkwardness signs, as in they're a little bit less coordinated. There's a number of primary conditions that are associated with growth, such as your oscar splatters, such as your severs, and instability issues with the shoulder. So the little start saying, oh, my knees are hurting, or my heels are hurting, your shoulders hurting on the serve. Those are the type of signs that you could be most aware of, because they're going to be your big three. Yeah. They're going to be the ones that are they're most likely to occur during that time. And primarily they are growth limited, which means when they finish growing, they will grow out of them. But there's lots of things that you can do to negate some of the symptoms, so, and to manage it as well. But I think also energy levels, which we'll talk on a little bit later. But the energy levels, if they're coming in tired and they're normally, they're coming in all guns blazing and they're a bit lackluster, or they're not lasting in a rally, maybe consideration around those things. But generally they start to complain of being sore, little niggles, and it's just working out, are they whinging, or is there actually something going on here that I need to be mindful of?
So then you would potentially take away some of their training, reduce their
which is not, I know it's not popular opinion with tennis coaches to reduce time on court, but sometimes the priority should be the physical maintenance and the prevention of injury, so that they don't end up with 3 months off court down the line. So prioritising their physical development during that time, and their recovery and the rest is also really important. Any other questions whilst we're on that? Yeah, Chris.
So Emily, is there an argument that we should be, as coaches, training our females separately from our males?
Not necessarily separately, but differently in some respect.
But if you're doing group sessions, that would be incredibly difficult to manage.
I think it's probably not so relevant in the tennis. I think you should be looking at ways of tailoring your tennis training to the individual where possible, but the physical training, that's where you're going to see the biggest difference. I think quite naturally we do evolve to say of mainly females with females and males with males once they get to that point where their tennis is getting quite different. I think that's a natural evolution of progression in performance. Okay, so a little bit more science. So I had Scott talking a lot about biomechanical angles and everything from a technical point, but what I think is often missed is consideration of how we might be biomechanically set up different in the first place. So we know that obviously women generally have wider hips. This changes the angle of the femur to the knee, and this changes the pathway of the force basically from your foot upwards and back down again. So you're going to see an increased knee valgus. Now, knee valgus is only problematic in relation to the foot. Okay, so you might see Ben Shelton serving, and he actually does have a valgus. He has an inward movement of both things. A lot of tennis players do, but his foot is in the same line, so everything is going that way. If your foot is straight but your knee is in, that's problematic, okay? Because now all the force that should be going nicely through that whole chain is going off at an angle through one part of your joint. That's going to cause problems. Increased pronation, we're talking about the foot here, not on your serve, so you're talking about the foot rolling in. So you're talking about the instep of your foot coming in. You're most likely to see that when they're doing that on one leg. So you look at them on their serve landing, is the foot rolling in. Again, this means all the force is going to the inside of the leg. So you're going to be looking at shin splints and things like that, which are going to be more problematic for women than they are going to be for men. So in totality, the poor tracking between the quads and the knee are just a huge flag for increased knee injury of any type. Increased collagen, so this is where we start to talk about hormonal differences. So the actual makeup of our soft tissue is different between females and males. So we have more elasticity, we're generally more flexible, and that's through every layer of soft tissue that we have, through tendons, through ligaments, through muscle, fascia, everything. So how we stabilize our joints is quite different, and we have to work a little bit harder because of that lack of collagen. More likely to be hypermobile. Anyone work with a hypermobile player? one person, okay? Anyone know how to assess a hypermobile player? Because I've seen about 500, I don't know. So if you have anybody, I'm a great example of this, who has extendable elbows. Yes, okay, now we have to not see how to train some hypermobile player. You have players who stand with their legs straight and their knees are swinging backwards, so that you've got basically a curve and not straight. Yes, if you have somebody who could touch their thumb to their wrist, all of those things are signs of hypermobility. And actually, if you Google it, we won't do all of it today, the Baton scale of hypermobility, you can get a score between 1 and 9 and see how hypermobile your player is. They're really, really easy tests, and they're like touch your toes, touch your thumb, etc. Tennis coaches can do it and be across it. If your player is hypermobile, do you have an idea of what stroke would be most impacted by that? Yes. Yeah. So your serve is going to be where they're going to struggle, either because they have too much movement or not enough control, which is basically the same thing, but essentially, especially back here, so you can see a lot of loss of control of the racket, and then the inability to decelerate after the contact. You also might see difficulties of changing direction. And then again, increased instability equals increased risk of injury. So the more movement a player has, the more unstable they're going to be unless you train them to be stable. So if you have a player that you think is wildly flexible, if not hypermobile, then stability should be built into their warm-up. Stability should be, shoulder work should be done before you do a big serving block. You need to be conditioning alongside what they need to stop them being injured and staying on court. Okay, so Scott did a little bit of this, so haven't done heaps, but something again to be thinking of when you're training a female athlete is that we see a difference in the age of which they're meeting these milestones, so they're your top 100, but we're talking about junior Grand Slams here, so we have one girl at 14 and 4 girls at 15, we've got no boys. Boys come in at 16, this is in regards to the French Open, and we've got 7 girls. At 17, so the average age of 16 and a half-ish, we've got 19 girls and 12 boys. And then by 18, we've only got 6 girls. So they're already gone. So by 18, your best players are not playing ITF, junior ITFs anymore, they're playing professional tennis. So if you backtrack from here to be winning at 16, then you're going to need to be in the top 50, probably higher if you're winning it. So to be top 50 by 16, by 15, this is age 15th birthday, and the 14th birthday, 13th birthday, you're going to need to be 100 here, 200 here, the milestones that Scott's talking about. So they happen earlier, which means that they're going to be needing age 14 to be ready to go onto tour to start building that ranking, to achieve that at 16. So if you have someone who is a talented but late maturing girl, a 13-year-old, she's only just finished growing, she probably hasn't gone through PWB, and all of a sudden we're into 25 weeks a year of ITF, plus domestics, plus nationals, plus team events. Are they physically ready to cope with those loads? Is there enough being done off the court and on the court to actually let them be supported in that space and be able to compete to the best of their ability? Often in New Zealand they're not. So that's something that we really, really need to change. And as Scott said, kind of the stats don't lie. So in regards to the French Open, it's a really good predictor of success at professional level. So you've got 100% making top 100, 90% making top 50, and 62% of winners making top 10. Okay, so I thought this was a great one in a room full of predominantly males, but who is comfortable having a conversation with their performance players around their cycle? Let's show of hands. Josh and Adam. Yeah, we've got 3 or 4. Yes, 5. Cool. I think we really need to be moving the dial on this in the performance space and having those conversations and in a way that the player is comfortable and feels safe. Because it can have a significant impact on the way that they perform and the way that they play and the way that they feel. So we know basics, average cycle is 28 days, can range. Day 1, here, oh hang on, let's find a little light here. Do I have a light on this?
No, just use your fingers.
Budget. Day 1 down here. This is where we look most like males. So if we looked at the male hormone track, it's basically like this. And you can see the women's is all over the place with different hormones. But during their cycle, they're actually most physiologically like a male. So if they have the energy available and are happy to, that's a good time for training. it's actually a good time for doing hard work. Everybody has different experiences in the way that they symptomatically, and they might not feel like that, but physiologically it's actually a good time for doing training. So you've got day 1 to 14 is called the follicular phase, and then you start to get increases in estrogen and luteinizing hormone and FSH just before ovulation, progesterone after ovulation. Day 15 to 28, luteal phase. And ovulation occurs right about in the middle. So you're probably going to notice different things at different times within the cycle if you're really tuned into your female athlete. This is probably really key for people who are doing a lot of work with one particular athlete or multiple days a week. Then you're going to notice different patterns throughout the month. And this isn't just being moody or anything like that, but you're talking about lots of different things that we'll get into a little bit after this. So some of those physical symptoms could be bloating, GI issues, struggling with heat, normally fine, but all of a sudden it's cramping, or it just looks like they're tanking, looks like they're not trying, they just really can't cope with the heat. Headaches, poor spatial cognition, mistiming everything, mood swings, lack of motivation, suddenly a really bad trader, normally pretty good trader, but these are small things that you can be thinking, oh, okay, what's going on physiologically here? Is it just that if you come down hard and go, oh, you're so lazy, why are you being like this today? Well, actually, maybe there's a really good physiological reason that could explain a lot of that. So maybe that's where, as a coach, you might have to increase the high support part of your role and decrease the high challenge part to make them feel a little more comfortable in that space. So actually, before I move on, the bit that I haven't included here is that a lack of period in those of the right age is probably your number one red flag for somebody who is either trending towards RES, which is your relative energy deficiency syndrome, or is already there. And the impact of that not happening can be quite significant. So we were talking about bone density before. The hormones that don't act as they should when you're amenorrheic, which means you don't have a cycle, can impact on bone density, and that's why you get increases in stress fractures and things like that. So maybe that's something to think about if you're having a player who is getting repeated low-level foot stress fractures, or hands or wrists, or anywhere lower back. Let's have a look at think about bone density, because in comparison to a male player, you might have different things contributing to what that looks like. Okay, so we talked a little bit about that. So yeah, during the cycle, you've got increased strength gains, decreased pain in everywhere else apart from maybe the uterus, and increased recovery. Opposite for high hormone phase, decreased reaction time, neuromuscular coordination and manual dexterity can go down. So that's more towards ovulation, middle of the cycle. And it can also negatively impact blood sugar levels, thermal regulation and breathing, so suddenly they don't look as fit as they were. They're not coping as well with the same training load. So this is where, when back to Chris's question, and you're saying, how do we train males and females differently? Maybe there is a piece around how much or how hard. So at different times, and you'd only know this if you kind of can tune into this, but perhaps they need a shorter session. So you go higher quality, higher intensity for a shorter amount of time during that week. And you might find you get a better response and a better output in terms of the effort that they're putting in. Nutrition. Because of this difference in hormones and the way that we produce energy and store energy, the hormones can dictate what we're using to produce energy. So whether that's, we rely less on carbs and better at using fat. So if they are predominantly a carb pasta eater, actually maybe good fats is a good thing to include in their diet if they don't have that coming in. That is a useful thing for good endurance, but not for high intensity effort. So maybe not apparent in your grinder type game style, but in those who have high power outputs, and they are dependent on those high intensity efforts, they might see a dip in that performance during that time. And it might be sort of more difficult for them to hit the intensities that they normally hit during the hormone phase, where basically our bodies are designed to spare the glycogen within our muscles. So we're trying to use fat, which is not as good for high intensity stuff. Slower to recover when estrogen is high, so that's just before ovulation, and in recovery, women will burn disproportionate amount of carbs. So later on in the cycle, we need more. It's really confusing. There's lots of things, but we won't get too much into this because it's just things to be sort of aware of. Just bring light to the fact that there's differences that you can get across and get more research into. Iron. It's a pretty obvious one, but it's really, really essential for human function. Facilitating energy, transporting oxygen. Big thing for our REDS, what we talked about earlier, relative energy deficiency status. And about 50% of female athletes will report being iron deficient at some time. And if they're not reporting it, they might not know it, but these sort of symptoms can relate to iron deficiency. So in a performance player who's got a high volume program, we need to be across, are you having a biannual blood test to check on your iron levels? If this is constantly an issue for you, or you can see, oh, she's got a cold again, it's the third cold in a row, like kind of those little bells can be ringing around, okay, what's the iron status like? Can we have a check on that? Because it's a very simple blood test that they can get done at their GPs. Not a confronting conversation and something that we should be across in performance. So regular testing, all performance players. And then there's a really easy fix. So ideal is dietary, but if they need it, supplementation, and if they're really, really bad, they might need an infusion, which is an IV infusion. So that can be recovered pretty quickly. So I didn't really know which bullet points to put in the kind of final bit, but we've got the first thing that we talked about was to decrease lows during PHP. So you might need to decrease tennis, increase physical support, physical conditioning. Increase your overall integration on physical conditioning, especially if your player doesn't have that. So they don't have an S&C program, they don't have an S&C coach they're working with, because not all setups across this country do. Can you be responsible for just building some of that into the warm-up? Being on to them about their cool down, giving them some homework to do. I know that all of you sitting here will have that, at least the basic knowledge, if not better, of what that looks like in terms of physical training. Let's be aware of the hormones that significantly impact women and girls throughout the different times of the month. The better you can be in tune with that, the better you will be able to work with them and to support them. It is okay to do hard stuff when they are on their period. I think that's a male thing might be, oh, she's on her period, I'll let her off. If she's feeling good and she's not in too much pain, or some women might want to be in bed for a couple of days, but if they're feeling good, go train hard, because that's when you get the best outcomes. And the week before is actually the week that you're going to see the fatigue, the emotional side that we're often labelled. And this is where you need to consider your high challenge, high support. There's kind of a phrase that we use, I don't know if you guys use it, so you want in a performance coach to be highly challenging but also highly supportive. So you're not just challenging them without any support and throwing them to the wolves, but the balance between the two needs to be varied at different times for different athletes, male and female, but consideration, especially for your female, around what might be causing certain behaviours or certain performances in your training sessions. Good. Questions? Try to catch up there. Yes.
From a performance-like girl who's been put on the contraceptive pill from a young age, whether like for her skin or for her periods or to cope with the performance, whatever, what are the physiological differences in like her growth being on the pill?
The physiological differences in her, what, sorry?
Like in her development, physical development. If she's on the pill from like a younger age.
There shouldn't be any physical development issues, but you have to be aware that her cycle is chemically induced and basically falsified. So after a while, it can take a long time for them to adapt to that, and they might find it difficult with a lot of other things, especially more gastrointestinal issues, emotional issues, and finding the right one is often a conversation that coaches might be supportive in helping, especially if they've been put on a contraceptive pill early for skin or whatever, because they might not be comfortable having it with their parent, but that's it shouldn't impact on their growth or their.
Is there any benefit or disadvantage from a performance?
I'm not going to pretend to know enough to really talk to that, but what I would say is that a number of professional females choose to go on the contraceptive pill because it gives them consistency, it gives them predictability, and it also can control those who are very symptomatic. But there's another point, and again, it's something to talk about with those who are comfortable, is that it is not healthy or normal to be really symptomatic. So if your player is in a lot of pain, has a lot of issues during their cycle, it is normalised that that's just, tough, you'll suck it up, it's going to happen every month. That is actually not normal. So that is go to your GP, have a conversation with them, because there might be something else going on. So we didn't get, there could be a multitude of things I'm not going to talk to, but that's a conversation. So if they're really, really struggling, then say, hey, this is not normal to be in this much pain. I suggest you go to your GP.
What age would you suggest